So treatment. There are two types of medications that we normally use to treat this. The first one is a coccidiostat. And that means that this medication stops the reproduction of the parasites, but they don't kill the parasites that are already present in the GI system. So it takes a while for the body's immune system to kick in and get rid of those parasites on its own. One of the most commonly used one is Albon. You guys might have heard of that. And it's the only on-label drug that's currently available. Another common one is TMS. It's a sulfa type of drug that we can use. However, more recently, there has been some interesting coccidiocidals. These drugs stop reproduction, but they also kill the parasites that are present. So people typically have found that animals respond faster to these drugs. It doesn't take the immune system to kick in to get rid of the burden. The most commonly used one is ponazuril. It's marketed as Marquise. And people have seen a faster response with this because it does stop the reproduction and also kills the parasites themselves. It is a large animal drug, so it does have to be diluted down to small animal doses. So just be careful when you're dosing your animals. And it is expensive when you buy the initial a syringe of it, but you can split it with other shelters or have it compounded, and it's pretty reasonable on a per animal basis. It's just when you buy the initial dose, it can be quite costly up front. So the treatment length varies based on the medication you choose. And especially since a lot of the drugs are off-label, there have been kind of some people have played with the different regimens that are available. Most drugs stop the replication, and the immune system must do the rest. However, ponazuril is the new drug that kind of goes against that rule. In the meantime, it's really important to provide supportive treatment, especially for your critically sick animals. So things like IV fluids or sub-Q fluids, depending on how severe the animal is. Also, appetite stimulants, close monitoring, those things will be really important. And then you want to bath and wash the animals to prevent any possible sources of reinfection. So let's look at this housing area. So it looks like this is probably a puppy kennel that's set up. There's no dog inside of it right now, but that's what I would imagine being in there. So what's good about this setup right here? What do you like about this setup in regards to Coccidia? Sorry? Dry, yeah, that's good, it's dry. Pardon? No carpets, yeah, so there's no carpets, but we're gonna talk about the wood in a minute, whether you guys think that that's a good surface to have. What about this? What's that? Yeah, a puppy pad, that's perfect. It's a good way to get rid of any mess, hopefully as long as the puppy's using it as soon as possible. I also like that this area is separate, or appears to be separate from the other animals, so away from other litters, away from your general population. So the bad things about it. So we mentioned the wood. Do you guys think that that's a good thing? Not. Yeah, so it's probably a little bit better than carpet, but the cysts still are gonna stick to the wood. Ideal would be a painted floor of some sort, possibly concrete, something that we can spray or like pressure wash the cysts off of. Also, these beds and the toys are cloth, which you can't always avoid. So as long as you're not super attached to them and we can throw them out or wash them in boiling water after to prevent any sources of reinfection. So changes we might do, we might change the flooring, we might look at the bedding, but if we're not super attached to the bedding, we can probably just dispose of that. Towel, yeah, it's really hard to find a comfortable bedding for a puppy or kitten that they're gonna like to sleep on that isn't gonna keep cysts in there. So as long as you're replacing them frequently or washing them in boiling water. Oh, the wire, yes, you're saying it was easy to clean? Every individual wire, yeah, that's exactly right. So what they were saying is the wires might be difficult to clean individually. There might be a cyst stuck on one surface that you haven't cleaned. So just be really conscientious of that. So next steps, we're gonna recheck a fecal in 2 weeks after treatment. And what if we find no clinical signs and the fecal flotation is clear? What do you guys think? Yay! But what if they still have clinical signs or their eggs present on the fecal? We're not quite as happy. So we want to look for other causes of diarrhea. Maybe it's another parasite that's causing this that we haven't addressed yet. Maybe we need to look at sources of reinfection. Have we washed that animal? Have we disposed of any bedding? Have we made sure the environment's clean? Maybe we need to try a different treatment regimen. Or look at our prevention protocols and techniques. So maybe we need to look at our husbandry a little bit.